Thank you, Dave, and thank everybody for coming late in the afternoon. So we want to have some fun this afternoon. We are not going to stand up here and in any way teach the code to you in any detail. Instead, you're going to dictate the content of our discussions during the next hour, because we're going to ask a series of questions, and then depending upon the response to those questions, then we will potentially go into more detail as to why a particular answer is a correct answer or an incorrect answer. We are going to be using both the 2000 and 2012 edition of the Life Safety Code, including the S&C memo that CMS put out for categorical waivers. When the slide comes up with a question up in the title box, we're prompting you what code we're looking for you to use to answer the question. That'll be important because in some instances we're asking for an IBC answer versus an NFPA answer. So the International Building Code will be used. There will be questions on certain reference standards such as NFPA 13, NFPA 99, and NFPA 105. And then lastly, there will be some questions on the facility guidelines. So again, the slide will prompt you as to what document you should be using. We do have a couple questions at the end that we're going to ask you to answer using multiple documents. So the issue of conflicts or differing requirements in codes will come up through those slides at the end as well. Allison?
So just a brief overview of our testing system. As you all walked in, you were given a clicker, and we're asking you to use this during the presentation. So what will happen is the question will be displayed with a selection of answers. You'll be able to select the multiple choice. It's all multiple choice, no open-ended, don't worry. Using the clicker. It is important to note that once the slide comes up, the polling will be open, so you'll be free to select the answer whenever you need to. And that will remain open until we progress to the next bar chart area. So you'll be able to change your response if you reread the question and decide that you don't like your initial answer.
Or if you see your neighbor gave a different answer, but their answer is probably wrong, so you probably don't want to change it.
Yeah, so we'll read the question, and to have a little bit more brevity, we'll let you read the potential answers up on the slide. So was there a question already? Yes. You can just change an answer by just selecting the button of the answer that you actually want. So you can vote twice. Well, it will only count
it once.
It will only
we count your last
vote.
answer.
Yeah, so it is intelligent, so it remembers the clicker and the response on there. Then based on the responses, we will go through and determine if further discussion is needed. This is an open format. We invite questions, as you just saw, and if you have any issues with the way the question is worded or with the answers, please feel free to raise your hand so we can discuss it as a group.
So if we see a high percentage of correct answers, like maybe 80% or something, we'll just display the correct answer and most likely we'll move on. But if you had a question about why one of the other answers isn't correct or why that answer is correct, ask the question at that time while we have the slide up there, as compared to waiting till the end and then we have to go back and figure out what question you were referring to. So are we ready then?
Yep, we're ready.
Okay, so Allison?
Everyone get your clickers ready. The first few sections will be on the 2013 CMS waiver memo. This really is adopting the portions of the 2012 Life Safety Code. And we're going to focus on suites and on doors, specifically locking arrangements. So just get that frame of reference in your mind right now.
First question.
What are the requirements for locking doors and the means of egress for patients who pose a security threat? And polling is open, so you can make your selection now. All right, we'll close the polling in just a moment, so if you would make your selection. Let's see the distribution.
Oh, I guess we have one to talk about right out of the bat. All right. So the correct answer is
B. The correct answer is B, to provide remote control of locks or keys carried by staff at all times. So we have the reference section on here, and this presentation I realized was not available as a handout. We will make it available after the presentation.
We didn't want you to cheat and study ahead of time.
And so you need remote control of locks from within the locked smoke compartment. That's very important. Or you need keying of all locks to be carried by staff members at all times. And there is a limit to only one locking device per door. So you can't have a multiple setup even if there's a security issue.
So there were some other aspects of some of the other questions. For example, item C says provide unlocking on sprinkler water flow or smoke alarm. That's not part of that paragraph in the Life Safety Code. It may be something you're doing in your facility. If you're doing it, that's probably through an equivalency clause now, instead of through that language in the 2012 edition of the code. Okay? And the first one, A, because you have the option of keys carried by staff or remote control, A was not correct. Yes, smoke detection could be required throughout the space, but then I had the option of keys or remote unlocking. Okay, next question.
Which of the following units is not applicable to the new healthcare special locking arrangements? And I apologize at the top, this is the 2012 Life Safety Code as well. And it does not include delayed egress or access control. So it's really the special locking arrangements as defined in chapters 18 and 19. And we'll close the polling in just a moment.
Okay.
All right. So, good job as a whole. The correct answer is A, operating suite. And the reasoning behind this is that special locking is permitted based on a clinical need, a security risk, and special measures for patient safety. So we've provided a few examples up here for those three different areas. However, operating suites are really just more of a general security need, so you'd need to use the access control or delayed egress, which would be an uncommon configuration.
Third question.
On to suites. Which egress options from a non-sleeping suite best describe the requirements for a new healthcare occupancy? And we'll close the polling in just a moment.
So Allison, before I actually move on, unless I fell asleep during your presentation, did you share with them where some of these questions came from?
Oh, I'm sorry, I didn't. A lot of these questions actually came from plan reviews that we've conducted in our office, and there have been issues whether with a design team or contractors, any other response teams, that it really creates a need to distribute this information so that you can see the reasoning behind all of these requirements.
Okay.
All right, and the correct response is C. So once again, good job. Where two means of egress are required, which in a non-sleeping suite is 2,500 square feet, and sleeping it's greater than 1,000 square feet. One of the means of egress is permitted to be into another suite as long as that separation meets the corridor requirement. So it's very important you still have to maintain that latching, smoke resistive, or that 1 hour partition.
So the concern that the committee has with answer A is that you're not likely to use that vertical means of relocating patients as you are going to a corridor or through a horizontal exit or something along that lines. So that's why A would not be something permitted by the code. B is a logical answer but not specifically permitted by the code. I personally think smoke barriers is probably a good option. In particular, all I would have to do is upgrade that smoke barrier by putting a latching device on the door, and that smoke barrier is going to meet corridor wall requirements. But it's not something specifically permitted in the code.
And here's just an example of the suite. You see that the corridor on the bottom, if that was the exit access corridor, then both of these suites would have one entrance or exit onto the exit access corridor, and then the door in between the suites is the second means of egress into the adjacent suite.
Okay, next question.
What type of fire protection is required in a new sleeping suite with an area between 7,500 and 10,000 square feet? We'll close the polling in just a moment.
Okay, I think we're going to challenge you on that one.
The answer is A, direct supervision and complete smoke detection within the suite. Direct supervision, as you see here, the other options, so...
All right, this is a little tricky, Bill. The building is sprinkled.
It's a new sleeping suite.
It's a new suite, yes, so it would be sprinklered. Okay, that's why the partial sprinkler is not an option, because new construction we sprinkler throughout.
I said new very clearly.
All right, told you we're going to have a little fun here.
All right, here's hopefully an easier one, all right? What is the maximum travel distance permitted between any point in a suite and the exit access corridor from a patient care non-sleeping suite?
So the next time you do this, you should use the Final Jeopardy music.
Yeah, I thought about that. And there's no lifelines here or anything like that that you can reach out to.
All right, we'll go ahead and close the polling now. All right, good. Okay, I want
This is great.
closer than
Okay.
that. I do want to reiterate that it says between any point in the suite and the exit access corridor. So this is a very different requirement, and you're not alone. This is something that comes up a lot in design projects. The difference between the travel distance between any point and the exit that's 200 feet. So that's
New
correct.
construction because you're sprinklered.
Correct. Thank you, Bill. However, this is between any point in the suite and the exit access corridor. So the correct answer is actually 100 feet.
What's the distance between the exit between the furthest point and the next smoke part?
To the smoke
that's
barrier door,
200 feet.
that would be 200 feet also.
Yeah. So this is really restricting the area, or really the layout of your suite, so that you don't have some really long extending suite that can cause any problems in an egress situation. So you want all of those occupants to be able to reach that protected exit access corridor within 100 feet.
The other thing, since we're talking about this issue, and I identified this in a presentation yesterday, but in the 2000 edition of the code, notice we said non-sleeping suite. There actually were two travel distances to the exit access door. One was 50 foot, one was 100 foot, depending upon the number of intervening rooms. And the committee took the number of intervening rooms out of the code and said it's just 100 feet. The important thing is how long it will take to get the patient to that corridor door. Well, last week, I got a very interesting interpretation from CMS that says they are not accepting that. And their categorical waiver refers to paragraph 257 when intervening rooms are addressed in paragraph 256. So I think it's very clear what the committee did, but right now, I'm hoping to get this issue resolved with CMS, but there may be some further limitations on this if you have more than one intervening room in the suite. Okay, next question.
A stairway located within the suite can be used to satisfy travel distance requirements for spaces outside the suite? Yes or no?
Oh, now I hear a group activity going on. We're talking about this.
All right. We'll close the polling in just a moment. There you go. All right.
You are consistent.
I couldn't have asked for a better distribution for this. So once again, let me point out the nuances of this question. You have an area outside the suite trying to access the exit that's within the suite. And there is a caveat to this question. The correct answer is no. You need to already be in the suite in order to access that exit. The caveat is that if you're in an adjacent suite, you can go through another suite without going into an exit access corridor in order to reach that exit. However, if you're in the exit access corridor, you cannot enter any intervening room, which a suite is considered a giant room. You cannot enter into that area in order to reach the exit.
And this is a common mistake we see, not just in healthcare, but a lot of occupancies, where somebody takes the lower end of the building, we convert it to a suite or a tenant space in an office building, and you have a stairway sitting in there. That is no longer an exit for people in other parts of the building, because the corridor needs to take you directly to the exit, as Allison said, without going through an intervening room.
Can you go back to the question?
Sure.
I was thinking vertical, not horizontal.
Okay.
All right, what separation is required between a new healthcare occupancy and a business occupancy? And this is assuming a separated mixed-use approach. We're not getting into any of the non-separated approaches right now.
Life safety code.
All right, we'll close the polling in just a moment.
All right, now we're on
good.
track.
Yes, the correct answer is C, a 2-hour fire resistance rated barrier. And that's required between both new healthcare and ambulatory, as well as new healthcare and business occupancies.
Okay, similar question.
How about the separation that is required between an ambulatory healthcare occupancy and a business occupancy? Close that polling in just a moment. All right, once again, very good. It's B, a 1-hour fire resistance rated barrier.
Okay, changing topics now.
Now we're going over into corridor requirements, and just a brief note, when you see just life safety code at the top, that LSC, that applies to both 2000 and 2012, so we're not trying to trick anyone with any additions there. All right, here's a long one. Ready? A required exit stair serving a new healthcare occupancy discharges inside the building into a business occupancy, which is protected throughout with an approved, supervised automatic sprinkler system. What are the corridor requirements in the business occupancy? So kind of a synopsis, you have a a stair serving healthcare that's discharging into a business occupancy that's protected with a sprinkler system. What are those corridor requirements? We'll close the polling in just a moment. All right, here's the trick. Answer B says the corridor along the path to the exterior must be smoke resistive. And the correct answer is actually that all of the corridors in the entire smoke compartment must be smoke resistive. And that's reliant on the healthcare occupancy requirements for the entire smoke zone that's applied on the business occupancy floor. So everywhere that the healthcare occupancy has to traverse and non-healthcare occupancy must meet those requirements.
Okay, we have a question.
And so if this business occupancy is more than 2 floors below the healthcare occupancy, it wouldn't be required to have smoke compartments.
Then you have one big smoke compartment because all the corridors and the means of egress from healthcare would be required to be capable of resisting the passage of smoke. I think this would be an interesting thing for people to somebody to potentially take on as a public input for the next revision cycle. You know, this is one that makes a lot of sense if I'm moving horizontally into the other occupancy that I need to meet the healthcare requirements. But folks, if I've already moved those patients downstairs, I don't know if I need an 8-foot corridor from that point on. But that's what the code says. I have to meet the healthcare requirements if I'm egressing through that space. So if you want to plant a seed, July 6th is the deadline for public input to the next additional life safety code.
And from a design standpoint, your question, sir, I think that sometimes a situation like that where you have a large floor, it might warrant constructing a small smoke barrier so that you limit the area that you're, responsible for protecting. Save a lot of money with door latching too.
There was also another key phrase here in the sense that we said the business occupancy was protected throughout with a sprinkler system, because if you could build that scenario, remember the building containing healthcare has to be sprinklered, but if I could build that scenario, if it was a separate building or something, if it's not sprinklered, then business would require 1 hour for new construction. So this one we're going to get, everybody's going to get.
What is
Maybe.
the minimum required corridor width of a patient unit of a hospital? This is new.
Good question, though.
We'll close that polling in just a moment. Beautiful. Answer is C.
Oh, I thought you were going to say A.
Oh, no. No, yeah. The 44-inch corridor comes from areas that are not intended for treatment of inpatients, and the 6-foot comes from psychiatric or behavioral and limited care facilities.
And actually in the 2015 code, not to confuse anybody, but in certain long-term care facilities, we can now go down to a 6-foot corridor as well.
So this is the 2012, back to 2012 Life Safety Code. A 10-foot corridor is provided in a hospital. Which of the following is not a requirement for fixed furniture in the corridor? So I'm switching it up a little bit. Now, which one is not a requirement for that fixed furniture in the 10-foot corridor?
What can you see? I'm sorry.
We'll close the polling in just a moment, so select your response. All right, pretty even distribution. The answer is C. The furniture is constructed of non-combustible materials. So once again, since I flipped that question, that is not a requirement for fixed furniture in the corridor. There are a number of other requirements, and I do suggest that you reference the code if you are trying to employ this. The other requirements are that the furniture must be located on only one side of the corridor. You can't have it staggered on both. And furniture groupings are separated by at least 10 feet. And that's really important, especially in some behavioral health facilities where you might be tempted to have it bolted all the way down the corridor. Furniture does not obstruct access to building service or fire protection equipment. And finally, the corridors must be provided with smoke detection, or the furniture spaces are under direct supervision from an area such as a nurse station.
And I just want to go back, if any of you were in George's presentation, you heard him talk about the corridor clutter issue and how that's an ongoing issue in facilities. Well, the 2012 code and the categorical waivers do allow us now to have wheeled carts in the corridor, that as long as we don't reduce the corridor width to something less than 5 feet, and the emergency plan is such that we will take those carts out of the corridor during the fire emergency. The carts either need to be in use or they need to be an emergency cart or something used for patient transport or patient lift. So there is language in the 2012 code to help you address that corridor clutter item that George addressed.
All right. What is the total amount of alcohol-based hand rub permitted outside of a storage cabinet in a single smoke compartment? Close the polling. All right, the answer is C, 10 gallons. The 0.32 gallons per room is the individual dispenser capacity that's permitted, and that's allowed in rooms, corridors, and areas open to the corridors. The 5 gallons is actually the trigger that you have to meet provisions for NFPA 30, which is the Flammable and Combustible Liquids Code. That 10-gallon limit per compartment excludes one dispenser per room or suite. Like I said before, a suite is considered one large space. So to think about having an alcohol-based hand rub dispenser in all of your ICU rooms, well, that's a problem because you can only discount one that's in that suite. So be careful when you're designing these spaces that you don't go over that 10-gallon limit.
And again, that might be something somebody might want to challenge the committee on in the upcoming revision cycle, because I'm not convinced that we really thought about the suite arrangement and what the limits could be in a suite. It is problematic. Allison recently had a client who, just put them all throughout the suite thinking, oh, and these don't count at all. And each little area of the suite they were thinking of as a room, but it wasn't a room off the corridor. The room off the corridor was the suite.
A floor of a building is classified as a healthcare occupancy. Where are smoke barriers required? We'll close the polling in just a moment. All right, the correct response is actually C, on the floor classified as healthcare and on the floor directly below the healthcare occupancy. So regardless of the occupancy, with some caveats, but for example, if there's a business floor below your healthcare occupancy, you are required to have a smoke barrier on serving that floor. They're not required where stories don't contain a healthcare occupancy and are more than one story. So like you mentioned earlier, yes, sir, if you're 2 stories below and you are a business occupancy, there's no requirement for smoke barriers. And same thing if you're above a healthcare occupancy, even just 1 story, there's no requirement for smoke barriers.
Is that the case even if you're egressing directly outside?
That's where yes.
Yes, it's not an egress-dependent issue. The concern the committee has is if the fire's on the floor below, and your emergency plan has us moving patients to the other side. If there's no barrier on that floor below, we can then get vertical smoke spread on the other side of the smoke barrier. Now, there's an interesting challenge here. that we've started to encounter more outside the U.S. than inside the U.S., where there's a number of healthcare facilities with parking directly below the ground floor, which is a healthcare occupancy. Good luck putting a smoke barrier in a parking garage. Again, there's some additional language in the 2015 you might find helpful, but I'm planting a seed if anybody wants to take that issue on for the next revision cycle. Okay, next question.
Also a smoke barrier question. A floor of a building is classified as a healthcare occupancy. The floor below does not contain smoke barriers. Which configuration is permitted? And now let me just say that this is permitted by the 2012 Life Safety Code. It is not yet adopted by Joint Commission and CMS. We'll close the polling in just a moment. All right, the correct response is B. The floor below is a mechanical equipment room separated by 2-hour construction. Now this is a special caveat in the code specifically for areas with only mechanical equipment. The entire floor must house mechanical equipment only and be separated by that 2-hour fire resistance rated construction. In terms of the business occupancy, selection A, that 2-hour really only serves as the occupancy separation. It does not take away the requirement for the smoke barrier on the floor below healthcare.
Yeah, I tried to use this in that parking garage scenario. You know, automobiles, mechanical equipment, didn't quite work.
When are new exit stairs required to have stair signage?
This is a sign that indicates what stair you're in and so forth.
We'll close the polling in just a moment. The correct answer is A. When serving 3 or more stories. In an existing facility, it's 5 or more stories. So that's where that response to question B comes in. But if you have a healthcare occupancy that is only 1 story, you're not required to have that stair signage. And actually on the next slide, Bill, here's an example of the stair signage. This is provided. Is there a question? Well, okay. But if you're 1 story of healthcare on a 3rd floor, and you have 2 business floors below, well, 1 business floor below, let me not back myself into a corner here, then you wouldn't have it required then. I was just going to say that. So the 2010 ADA does require you to have Braille on there. From experience surveying, let me say, photocopying Braille does not make it Braille. So you do need that tactile Braille on the sign. But as you can see, you have an example. Yeah, 3D printer. As you can see, there's an example here. It says the name of the stair, the current floor you're on. I realize the print gets a little small, but the floor served. If there's no roof access, the direction to the level of exit discharge, and an arrow with that direction on there.
And I'm going to offer a personal interpretation on this. The code says that the sign is to be visible with the door open or closed. And I actually had a facility cited during the survey process because the person was in the corridor outside the stair and the stair door was closed and they couldn't see the sign. And I said, no, the intent is for someone inside the stair. So if you happen to run into that surveyor, you might challenge that finding. Next question.
Hazardous areas. In a new healthcare occupancy, which of the following does not require a 1-hour fire resistance rated barrier per the Life Safety Code? We'll close the polling in just a moment. C, very good. 65 square foot clean linen room. So storage rooms between 50 and 100 square feet, they're still classified as hazardous. They still require the self-closing door. However, in new construction, they're not required to have that 1 hour. Yes, sir.
Doesn't it actually say, the first one, the right answer could also be A, because it says a soiled linen room, not a soiled utility room. I know most of the time they're using utility rooms for linen rooms or trash rooms, but technically doesn't it say linen room?
It does, but the intent of this really was for the soiled linen. It really is to show that the soiled linen utility rooms of any size require that 1 hour.
Let's make it tougher.
Yeah.
What about two 64-gallon garbage bags that's in my clean linen room in 65 square feet?
Now that's also related to the IBC, which defines that the 60.
Well, the Life Safety Code has that too. The storage of the containers.
So if this is a 65 square foot clean linen room that is in a new facility with nothing in it yet, and it's just designated that on the plans. We're doing a plan review.
But who's storing waste in a clean linen room?
What hospital is that? No, I'm kidding.
Okay, now we're switching to the IBC.
So in the IBC, hazardous areas are a very different thing. They call these incidental use areas. So we're switching gears a little bit. Which of the following rooms require a 1 hour fire resistance rated separation in a healthcare occupancy? And we'll close the polling. All right. And this was meant for that. The correct response is actually C, a 45 square foot linen collection room. The incinerator room actually requires 2 hours, so this is only 1. And the 85 square foot boiler room, it's dependent on the boiler equipment within the room. So we tricked you a little bit with the square footages. However, the point is really that any linen collection room, and this is both in healthcare and ambulatory healthcare of any size, is required to have a 1 hour fire resistance rating per the IBC.
By collection, you consider that the same as supply as well as soil linen?
I think that the table says linen collection, but absent from that table is storage. So this is what we're identifying here is there are some differences in the table in Chapter 18 versus the table in the IBC.
You see Massachusetts deviation for clean supply when you're storing linens in for this part of IBC.
Wow.
Okay, so for purposes of the recording, the comment was that in Massachusetts it would be required for clean linen as well, correct?
Correct.
Okay.
Got it.
Staying with the IBC.
For horizontal exits, which percentage of the total number of exits from a healthcare I2 occupancy are permitted to be horizontal exits? All right, and we'll go ahead and close the polling. The correct answer is actually B. So in I3, which is detention and correctional facilities, you're permitted up to 100%. For I2, you're permitted to have 2/3 or 66%. And in all other occupancies, only half are permitted to be horizontal exits. And when you're designing horizontal exits, be careful because there are a lot of additional implications involved with those, so you can't just put one in for convenience.
Including the continuity of the barrier.
Yes.
The biggest violation we see is somebody has a problem on a floor, they say, oh, we'll put a horizontal exit up, and they say, oh, but the floor is 2 hours, which is fine, but then if the barrier doesn't go all the way to the ground, all your other exits serving that area have to discharge to the outside. And that is commonly overlooked, or we see it commonly overlooked. I'm sure nobody in this room would do that, but we have seen a number of firms do that.
Along those same lines, which of the following is not a requirement for horizontal exits for Group I-2 per the IBC? We'll close the polling in just a moment. C. Very good. And the reasoning behind that is because it's not 3 square feet per person that's required, it's 30 square feet for healthcare. And as you see, there's 15 square feet and 6 for other areas in healthcare occupancies. However, this is another issue when designing horizontal exits. You want to make sure that you have the refuge capacity on both sides of that horizontal exit. There was a case that I worked on, and this was an existing facility, but they tried to alleviate an exit issue by creating a small horizontal exit in one portion of their building. Well, the problem was the corridor on the other side of that horizontal exit might have been 200 feet long, if that. So to have that small space serve this entire floor, it was really not permitting the proper refuge area requirements. All right, and atriums. Which of the following is not an acceptable separation between an atrium and adjacent spaces? We'll close the polling in just a moment. The answer is B, smoke barrier. So for A, glass wall forming a smoke partition is permitted as long as you provide the closely spaced sprinklers based on the IBC provisions. And a glass block wall with a 45-minute fire resistance rating is actually permitted as that separation between adjacent spaces.
And again, I could potentially make the argument that if my smoke barrier met the other criteria that is in the atrium section, that we could use it, but it's not one of those listed as a separation between the atrium and other spaces.
And just one more note, an atrium can be open to up to 3 floors if an area is accounted for in the smoke control system. I was doing a plan review recently, and it came up that the separation was not provided, and so they tried to say, well, we can just include all this area in the smoke control system. And it was a great idea, except the smoke control system was already designed in size. So you really want to be mindful in your design process if that's going to be an option, because you'll essentially make your smoke control system useless. All right, NFPA 13. What is the required minimum clearance measured vertically from a sprinkler deflector to an obstruction?
Well, we got a lot of sprinkler experts in the room. Look at that.
It's going fast.
Got the answers fast on that one.
We'll close the polling in just a minute, so get your answer in. There you go. B, 18 inches. Very good.
And vertically is the important thing there. And I know I've seen George do this presentation where they're 18 inches from the sprinkler, but 20 inches off to the side of the sprinkler, they go up to the ceiling. There are some exceptions here.
Yeah, so NFPA 13 does permit storage against, or shelving and storage against a wall, as long as it's not directly under a sprinkler. I realize that operationally this might be confusing to staff members. A lot of times you see the red stripe painted around the entire wall, so some facilities do apply that universal rule just to limit any confusion. A renovation occurs in a hospital. Quick response sprinklers are installed. Are the sprinklers in the entire smoke zone required to be replaced?
And we want the NFPA 13 answer on this.
Yes. We'll close the polling in just a moment. All right, and the correct response is C. Very good. Now, the caveat to this is, and as Bill said with the NFPA 13 definition, is that NFPA 13 defines a compartment as a space enclosed by walls and a ceiling. So essentially that means if we were to replace the sprinklers in this room, only the sprinklers in this room would be required to be quick response. Joint Commission's interpretation is the entire smoke compartment. So be mindful of that if you're doing a renovation project, that you will have to replace them throughout the entire smoke zone.
Okay, George is back there shaking his head no, but I know that people have been told that. Okay, yeah, it's this definition of compartment, and that's why we emphasize the word compartment, because it is the NFPA 13 compartment. NFPA 13 dictates that how many, if I'm allowed to have different response characteristics within the same compartment.
When are dampers in a healthcare occupancy required to be tested?
And 105, so that would be smoke dampers.
We'll close the polling in just a moment. All right. B, within 1 year of installation and then every 6 years.
And 105 was revised to say, I thought we had that on the slide, that any building containing a hospital, you get to use this throughout the building, not just the healthcare occupancy.
All right. What are the separation requirements for a cylinder storage room with over 3,000 cubic feet of non-flammable gases? Very good. The correct response is B. For less than 300 cubic feet, it's permitted to be in the smoke zone without any separation. Sorry, okay. And between 300 and 3,000 cubic feet, it's permitted in a non-rated room with sprinkler protection and clearance from your combustibles. So that's really important as well. And then over 3,000, of course, is the 1 hour enclosure with ventilation. That ventilation does have to be within 12 inches of either the floor or the ceiling, depending on the gases that you're storing within. So be careful not to have it at the floor when you really need it at the ceiling.
And I don't think that has changed in the 12 edition, so that answer would apply for 2012 as well. Okay, FGI.
The minimum ceiling height required in a normally occupied area of a hospital shall be close the polling in just a moment.
We got the IBC and NFPA 101 answer.
So it is 7'10", and the key here is the normally occupied areas of the hospital. The corridor ceiling height can be 7'6" in the FGI as well.
But the habitable spaces is required to have a 7'10" ceiling. Another FGI question.
Main electrical switchboards are required to be I'll close the polling in just a moment. Very good. Located in an area accessible only to authorized persons.
Okay, so these next couple, you have to look at the title because you're going to be dealing with multiple documents.
So this is NFPA 101, 2012 edition, and NFPA 13. Are sprinklers required in all closets not exceeding 6 square feet and located in a patient's sleeping room? I'll close the polling in just a moment. The correct answer is no.
But be careful with this one. The 2012 edition of the Life Safety Code says no. We've taken exception to NFPA 13. It's the 2013 edition of NFPA 13 that has been modified to say sprinklers are not required in certain closets in patient sleeping rooms. If you have to comply with the IBC, you are probably referring to a different edition of NFPA 13. So the answer might have to be just the opposite. If your building code official requires you to meet that earlier edition of NFPA 13. Similar now, 101 in the IBC.
Are smoke dampers required at the duct penetrations of smoke barriers in a new healthcare occupancy?
IBC 2012.
I'll close the polling in just a moment. Pretty close. Correct answer is yes.
And that's a key on the 2012. ASHI's advocacy team has gotten that changed through the ICC process. The 2015 edition omits the requirement for dampers at duct penetrations of smoke barriers using the same criteria that's in 101. But that's why you might be seeing these dampers when we keep saying, oh, the Life Safety Code doesn't require it. It's coming in there through the IBC. And last question.
May corridor walls terminate 6 inches above a suspended ceiling system in a new healthcare occupancy? I'll close the polling in just a moment.
Okay, so 48% of you have been to a seminar that I've taught, because I've said every fire protection question can be answered with "it depends." That's not the answer we were looking for, but okay, I'll give that to you. So there's some interesting interpretations here. First off, the Life Safety Code says you may terminate it at the ceiling. I've actually had an inspector say to a facility that was 6 inches above the ceiling, no, that's not okay. You didn't terminate it at the ceiling, which I think is ridiculous, but that's what the code says. So again, anybody wants to submit a public input, go for it. The IBC commentary says that suspended ceilings are not considered capable of resisting the passage of smoke. That is commentary language. Now, we have a little problem here because the ASHI advocacy team did try to address this issue last code change cycle as well, and while they were successful for existing buildings, they were not successful for new construction. And while you won't see any change in terminology in the IBC, I clearly have to interpret the IBC right now to say, if you have laid an acoustical tile, your corridors need to go all the way up. Until, hopefully, well, 2018 will take a little while to come out, but that is on the agenda, right, for Memphis? Yes. So they have come back to re-look at this issue in the next code change cycle, and hopefully we will address that issue. So, a couple things before you leave. Please do, I guess we can unlock those doors? No, we didn't lock them in here, did we, Tim? Seriously, please do not walk off with this device. Secondly, and I'm sure Ashley would really welcome your feedback. As you notice, this was a little different session than most of the ones you've seen this week. We clearly could have done the whole session on almost any one of these documents. We felt it gave us the ability to focus on things that you might be having problems with. So if you like the approach, I would encourage you to indicate that in the evaluations. Remember, there is no written evaluation. You have to go onto the website or the app, I guess, to fill out the evaluation. So with that, Allison and I thank you for your participation and staying here so late.